Ji, I am Dr. Sadia Saqib, Assistant Professor of Anatomy in King Edward Medical University. Today's topic is actually the general introduction of human anatomy. Anatomy is a field of science that deals with the study of structure or form of biological organisms. Biological organisms, including both plants and animals. In human anatomy, it's the study of structure or form of human body. If we study the structure or form of the human being, then it's a human anatomy. There are different branches of anatomy. There is gross anatomy, there is histology and cytology, functional anatomy, embryology or developmental anatomy. There's surgical anatomy, surface anatomy, clinical or applied anatomy, radiological anatomy, or comparative anatomy. All these are different branches of human anatomy. We will study the different aspects of anatomy in all these branches. There is gross anatomy, in which we study the human body through our naked eye. Without using any instrument, we study the different features of anatomy. And in this, we do dissection, and by doing dissection, we study the different structures of human anatomy. Then there is histology or cytology, in which we use a microscope to study the detailed structure of cell. Then there is functional anatomy. This is the functional aspect of human anatomy. There is embryology or developmental anatomy, in which we study the detailed structure of human embryo, how it develops, and what is the different time period in which the different structures develop. There is surgical anatomy, in which we study the surgical aspect of human anatomy. There is surface anatomy, that is by seeing just on the surface of the human body, we can understand that what structures are present underneath. There are clinical and applied anatomy, in which we study the clinical aspect of the anatomy. There is radiological anatomy, in which we see by just seeing just an X-ray, we can understand that what are the different structures of the human body which are visible on an X-ray. And there is comparative anatomy, in which we study the comparison of the human body with the other animals or with other mammals, and we can also compare the human body with other groups of the vertebrates, that are birds and the reptiles or other animals. This is the comparative anatomy. What is the normal anatomical position of the human body? Human body is supposed to be in erect position with the arms pendant and the lower limbs together, the eyes, palms of hand and toes directly face forward. This position, which is visible in the slide, this is actually the normal anatomical position or the supine position of the human body. When we talk about any structure or any part of the human anatomy, then we assume that body is in this anatomical or the supine position, in which it is an erect position, in which the arms are hanging by the side and the palms of the hands are facing forwards. Okay, palms of the hands are facing forwards, eyes are facing forwards, and the toes are facing forwards. This is the normal anatomical or the supine position. Then, what are the different commonly used planes? First of all, there is a median plane. Median plane is actually a plane, or actually, it divides the body into two equal halves. This is a plane which is passing through the center of the body, and it divides the body into two equal halves, right and the left halves. Then there is sagittal plane, any plane which is parallel to the median plane. Sagittal plane can be in the midline or it is parallel to the median plane, and it also divides the body into halves, into not equal halves. If it is passing through the median to the central part of the body, then it divides the body into two equal halves. Otherwise, it divides the body and it is just parallel to the median plane. Then there is coronal or frontal plane, a vertical plane present at right angles to the median plane. It is actually a plane which is, yes, this is the central one. This is the sagittal plane. It divides the body through the center. It can be in the center or it can be parallel to the central plane. So this is the sagittal section. Okay. If it is in the midline, then it is the median plane. Then it divides the body into equal right and the left halves. This is the coronal plane, which is actually passing at right angles to the sagittal plane, and it is dividing the body into anterior and the posterior halves, into front and the back halves. This is the coronal or the frontal plane. Then this is a transverse or the horizontal plane, which is actually horizontal or transverse to the ground. It is parallel to the ground. Okay? It is actually dividing the body into upper and the lower halves. Okay. So coronal plane is a vertical plane present at right angles to the median plane, and horizontal plane a plane parallel to the horizon or the ground. It is known as the horizontal plane. Then there is an oblique plane. Oblique plane actually divides the body. It passes through the body at an angle. This is the diagram showing the oblique plane. Any plane which is at an angle oblique to above fundamental planes is known as oblique plane. Okay? This is the oblique plane. If we have to see some specific structures, we use this plane. Otherwise, this plane is not used commonly. Okay, this is the diagrammatic representation again of the central one is the sagittal plane, then there is a coronal plane, then there is a transverse plane. All these planes divide the body into halves. Then there are commonly used terms, relationship or comparison. There is ventral or anterior, there is dorsal or posterior. Ventral or anterior, it refers to the structure situated nearer to the abdominal surface. If any structure in the body is nearer to the abdominal surface, for example, sternum is ventral to the heart. Because sternum is present anterior to the heart, it is present more towards the abdominal part, more towards the abdominal side of the body. It is actually in the ventral position or in the anterior position. There is dorsal or posterior. It refers to the structures nearer to the back or towards the vertebral column. Okay, vertebral column is dorsal to the heart. Okay, anything which is nearer to the abdominal side of the body, it is ventral. It is in the ventral position of the body, and anything which is nearer to the vertebral column, nearer to the back of the body, it is actually the dorsal. Then there is medial and lateral. It refers to the structures present nearer to the center of the body. Anything which is present towards the center of the body, towards the or nearer to the center of the body, it is medial, and anything which is away from the center of the body, it is lateral. Heart is medial to the lung. Heart is present in the central position. It is more towards the center of the body. That's why they are medial. Heart is medial, and the lungs are present in the away from the center of the body, or they are present in more lateral position. in more peripheral position in the chest. That's why they are in the lateral position. There is superior, the other term can be used cephalic, cranial, upper, rostral. This is the same term. The different terms which are used for the same structure. It pertains to structures present higher to some reference point or structures nearer to the upper end of the body. If anything which is present towards the upper end of the body or towards the head side of the body, then it is called superior, cephalic, cranial, upper, rostral. We can use any term. For example, the upper limb is superior to the lower limb, inferior or caudal or lower. Anything nearer to the tail or nearer to the foot end of the body is inferior, caudal or lower. Lower limb is inferior to the upper limb. Then there is proximal and distal. Proximal is refers to the structures nearer to the reference point. Again, we can say proximal is a structure which is present towards the body, towards the center of the body. This is called proximal, and anything which is away from the center of the body is distal. Okay, we can say here the superior radioulnar joint is used. A term superior radioulnar joint is used, which is you are not familiar with this term. So we can use that shoulder joint is more proximal to the body as compared to the elbow joint. And again, elbow joint is distal to the body as compared to the shoulder joint. We can use these terms in comparison. Okay, next is elbow. If we compare the elbow joint and the wrist joint, then we can say that elbow joint is proximal to the body while the wrist joint is distal to the body. Anything which is towards the central point of the body, it is actually the proximal, and anything which is away from the central point, away from the body, it is the distal. Okay, next is the superficial or external. Okay, it refers to the features on the outer surface of some organ or the viscera, or any outer appearance of the organ or viscera. We can say it external or superficial, or anything which is deep surface or inner part of the organ. We can call it internal or deep. Then there is ipsilateral or contralateral. Ipsilateral refers to the relationship between two structures present on the same side of the body. If two structures present on the same side of the body, we call them ipsilateral. And if the structures refers to the contralateral, it refers to the relationship between two structures present on the opposite side of the body. These are called contralateral. Okay, we can. This is the diagrammatic representation of ipsilateral and contralateral. Okay, this is the ipsilateral half of the body. The first diagram showing the ipsilateral half of the body, that is half of the same side of the face, half of the same side of the body. This is the first diagram is showing the ipsilateral relationship of the half of the body and half of the face. And next is the contralateral, half of the face and the contralateral half of the body. That is the opposite sides of the body and the face are affected. And in this third diagram, we can say that contralateral half of the body, a contralateral lower limbs are involved. Both lower limbs, right and the left. So this is the ipsilateral, the first diagram, that is the face and the body of the same side is involved. And in the second diagram, the face and the body of the contralateral halves are involved. And in third diagram, this is showing that contralateral lower limbs are involved. This is the ipsilateral and contralateral. Okay, next is the pre-axial border and the post-axial border. Okay, pre-axial border is actually, it refers to the outer border or the radial border in upper limb. Okay, outer border or the radial border in the upper limb, and it refers to the inner border or tibial border in case of lower limb. Okay, for pre-axial and the post-axial, you have to see this diagram. Okay, this is the radial border or the pre-axial border. Here the radius bone is showing red. So this is the outer border of the upper limb, okay, and the radial border of the upper limb. This is the pre-axial border, and the ulnar border of the upper limb. This is the post-axial border. Okay, in case of upper limb, we have two borders. The radial border is the preaxial border, and the ulnar border is the postaxial border. And this division of the preaxial and the postaxial border is actually developmentally, because initially the limbs, when limbs develop, then there is actually the direction of the limb is such that we can say this pre-axial border and the post-axial border. But while when rotation occurs, then these pre-axial and the post-axial border, they orientate themselves as the radial and the ulnar border. ठीक है? Okay. ये हम एम्ब्रियोलॉजी में देखेंगे, जब हम एम्ब्रियोलॉजी में इसको डिटेल में देखेंगे. ठीक है, नेक्स्ट डायग्राम. एंड this is the tibial or the preaxial border for the lower limb. Again, the tibia is medially, and this is the preaxial border, and this is because of the opposite side rotation of the lower limb. So there is fibular or the postaxial borders which are present on the lower limb. Okay, this is the preaxial and the postaxial borders. Then we have flexor surface and extensor surface. Flexor surface, it refers to the anterior surface of the upper limb. For the upper limb and the whole body, the flexor surface is the anterior surface. But for the lower limbs only, the flexor surface is actually the posterior surface. And again, this is because of the difference in the rotation of upper and the lower limbs developmentally. There is the difference of the flexor and the extensor surfaces of the upper and the lower limbs. So for the whole body and the upper limbs, the flexor surface is the anterior surface, but there is exception of the lower limbs. For the lower limbs, the flexor surface is the posterior surface. And again, for the extensor surface, it refers to the posterior surface of the upper limb and posterior surface of the trunk also. But in case of lower limb, it refers to the anterior surface of the lower limb. Then there is palmar surface and plantar surface. Palmar surface is the plane of the hand. It is the actually palm of the hand. And plantar surface, it is the plane of the sole of the foot. This is the diagrammatic representation. All these terms are showing. Here we show them diagrammatically. The anterior or the ventral surface for the trunk, and for the upper limbs, the anterior or the ventral surface. And Posterior or the dorsal surface means the posterior or the back. Anything which is close to the abdominal part, this is the anterior or the ventral, and anything which is close to the vertebral column or to the back, it is posterior. Then there is a midline plane. Anything which is close to the midline plane, it is the medial, and which is away from the midline plane, which is farther from the midline plane, it is lateral. Okay. Then there is cephalic or caudal. Anything which is towards the superior surface of the body, that is towards the head of the body, it is superior, and anything which is towards the feet of the body, it is inferior or caudal. Then there is proximal and distal. Anything which is close to the midline, which is towards the body, is proximal, and anything which is away from the body is distal. And we use these terms relatively also. Okay, if we talk about the shoulder and the elbow joint, then shoulder joint is proximal while the elbow joint is distal. But if we use the example of elbow joint and wrist joint, then elbow joint is more proximal to the body while the wrist joint is distal to the body. This is the diagram showing the internal and the external surface. Internal means deep surface and external means superficial surface. This is the diagram of the stomach. This is the outer surface showing the external or the superficial surface, and here is the diagram showing the deep grooves of the inner surface of the stomach. This is the deep or the internal surface. Then we have seen this diagram. Now this is the flexor or the extensor surface. The flexor or the anterior surface or the ventral surface is same for the trunk and the upper limbs. This is the flexor surface is the anterior surface for the trunk and the upper limbs, but in case of lower limbs, flexor surface is the posterior surface of the lower limbs, and this is due to the difference in rotation embryologically. And there is also extensor surface for the trunk and the upper limb. The extensor surface is the posterior surface. But for the lower limbs, the extensor surface is the anterior surface. This is the palmar surface and the dorsal surface. This is a more complex diagram showing here, but you can see this is the palmar surface and this is the dorsal surface. Okay, next there is plantar surface and the dorsal surface. Plantar surface means the surface of the sole side of the foot, and the dorsal surface is the dorsum of the foot.